Okay, let's get started. Sorry for delaying because of the whatever technical problem. But thank you so much for coming and hearing through the WebEx. I'm Hee Lee. I'm professor at the UVM School of Social Work. Basically, I'm sharing with you my preliminary findings from my research on health literacy. I received 2 funding to analyze the data using the California Health Innovation Survey 2007 wave to see how the parental health literacy related to children's health and mental health outcomes. So I'd like to share with you the preliminary data analysis and the outcome today. Okay, before talking about the health literacy and the parent health literacy outcome on the children's mental health, I like to start this presentation by defining the health literacy. I'd like to ask you a question first. In your world, what is health literacy? Anyone in this classroom? Just in your understanding, what is health literacy?
Knowing what's sensible to be healthy.
Right. To know what consists of health, what do we need to know? We need to know about the health information, right? We need to understand, we need to obtain the health information first, right? So it belongs to obtain. And then after you obtain the health information, you need to understand it, right? And then you need to process it, the health information, and then you need to act upon that information and then apply to your real life, right? That's the whole thing about health literacy. So Layson and Parker in 2000, these people defined health literacy as degree to individual have the capacity to obtain, process, and understand basic health information, and the services need to make appropriate health decisions. But one thing is missing in this definition, which is act upon. You need to apply this understood health information into your real life. So nowadays, the American Health Literacy Conference, the association try to extend this definition to integrate the act part. Okay, let's move on to mental health literacy. What is mental health literacy? It's kind of the same as health literacy, but it's more related to mental health. So Jerome, who is the researcher in mental health literacy literature, he defined mental health literacy as knowledge and beliefs about mental disorder which aid their recognition, management, or prevention. So this is kind of knowledge about mental disorder, but still missing, how to obtain the available services out there and how to communicate with mental health providers. So this definition still, it's good that we have one, but this definition still need to extend to integrate other part of mental health literacy. So we still see that there are some limitations in this existing the definition. Then why do we care about health literacy? It is because the health literacy impacts the timely access to health services and also use of health services. The health literacy is related to limited awareness of health symptoms. So if we don't know about, the whatever pain we have that related to the disorder or symptoms, we cannot really talk to our healthcare provider. So First of all, we are not really aware of our health symptoms if you have low level of health literacy, and then you have a lack of knowledge of where to seek services. So it's directly related to your health seeking behavior. And then health literacy also limited ability to identifying illnesses, as well as because of the lack of health literacy, you will use the less, health service utilization. So there's a lot of problems related to lack of health literacy in general public. Oops. And there's another areas that we need to look at why health literacy is important. Health literacy limits individuals' ability to communicate with healthcare providers. This is really big one. Whenever, particularly the immigrant or refugee family members attended a clinic visit, they first of all have a problem with talking to the staff, the front desk staff, and then next, working with the clinicians and physicians, they don't know what to ask if they have, low level of health literacy. So communication is a big problem. And then health literacy affects individuals' understanding and ability to follow health instructions. Let's say the clinicians give you some instruction, how often you need to take this medication, and, how often you fill up the medication. If you don't understand that instruction, it's going to be a big problem for yourself as well as your family members. So there's some existing literature that reporting a lack of health literacy in parents. For example, 1 in 4 parents in the United States have limited health literacy skills. So this is a big problem because, the parents need to work with their children when they are sick. So 1 in 4 is 25%, which is really high percentage of the parents lacking health literacy. And then in general, 1/3 of U.S. adults are not able to perform basic health wellness tasks. So this is another big indication of, our parents in the United States having some problem working with healthcare providers and taking care of their children. And the focus of Asian immigrants today, in my research, Asian American immigrants had the lowest the health literacy level as compared to other racial ethnic groups. So I want to revisit this low health literacy in this Asian American immigrants today, if that is true. So I will show you the level of health literacy in this population a little later. And then also continuously looking at the mental health literacy problem. Low knowledge about mental health disorders by the general public is really, really prevalent. So there's a lack of understanding on how to recognize developing disorder. In my experience in Asian American community, if our child is sick, if my child is sick, I always thinking about maybe I need to take my kids to the acupuncturist to get some, medicine so that my child can be, feel better or cured. So that kind of alternative medicine is more prevalent instead of really taking the kids to the clinic directly. So that's kind of another alternative way of taking care of our child, which might be appropriate for that symptoms, but maybe not be appropriate for other symptoms. So this is sort of another way of cultural health literacy. And then there's a lot of poor knowledge about effective self-help strategy, just like I said, alternative medicine, and also how to seek help for, children's, problems or mental health problems. And then about 18% of the total U.S. population experienced a mental health illness in 2014. And then about 13% of children aged between 8 to 13 years old had a diagnosable mental health disorder in the last year. So we see that the mental health problem is pretty high. And then Asian American and Native Hawaiian and other Pacific Islanders had the highest rate of mental health disorder, which is 21 and 22% respectively. So we see that the problem is really high in this Asian American and also Pacific Islanders. I think it is because we are not really dealing with these problems at timely manner. So I'd like to give you some, some innovation strategy, how to deal with these problems through my the research findings. And another the big problem is that Asian American may be of particular interest because Asian Americans usually underutilize mental health services because of the high stigma in this population. So just like I said, if we observe low energy among the children, we see that it's more health symptoms instead of mental health symptoms. And then we try not to recognize the mental symptoms because of the huge stigma around it. The depression or schizophrenia or anxiety or PTSD, we don't really want to acknowledge because it's a kind of family humiliation, it's family stigma. So there's a lot of cultural stuff going on in mental health as well as health issues. So our presentation today is focusing on more parents and children. So why am I, focusing on this parents and children issues? Because parents are sort of a gateway to from which we could address the health disparity in children mental health outcomes. And then parents are primary control over their children's health and also mental health decisions. And then the previous research supports relationship between parental health literacy and the children physical and mental health outcomes. So we see that parents are very important people to really taking care of or improving the children's health. So here's the sort of figure summarizing the parent's role when their children are sick or mentally ill. And then first of all, parents, with their kids, they need to understand what the forms, what the medical instructions are for their children. So the health or mental health literacy is the key to understand the existing forms or instructions or whatever brochures from the clinics or internet or whatever the pharmacy. So the parents have to understand the existing health information. And the parents also need to communicate with these physicians or nurses or social workers. So the communication, the health literacy related to communication is also another important area. And also, they need to log or they need to record whatever the instruction by the healthcare providers so that understanding the instructions when they get home and they're using the instructions for their children. And also, the parents need to deal with healthcare insurance company. So they need to know how to use their health insurance. There are so many people out there, if the preventive care is free for their children, they don't know about that very basic knowledge. So they need to know how to use health insurance and then how to talk to the health insurance company, what is covered, what is not covered. And finally, they need to deal with the pharmacy. I mean, they need to take the children, they need to take a medication, so they need to talk to the pharmacist, and then they need to fill up their medications, all that. So these whole 5 areas related to the parents' health for the children's health and mental health. So I try to look at what are the gaps in current research. Very little research has looked at the effect of parental health literacy has on child mental health outcome as well as the health outcome or utilization of mental health services or health services. And then limited understanding of health literacy in Asian American immigrant population. There is no, except my one article out there, there is no knowledge around, how Asian American parents' health literacy impact on their children's health and mental health outcome. So to close this gap, I proposed this research, and then I analyzed the data that I introduced at the first slide, the California Health Innovation Survey. So this research aims is to investigate the impact of parental health literacy on children's health and mental health outcome, as well as service utilization among Asian American immigrant parents. To accomplish these aims, I have these three research questions. First of all, what are the levels of health literacy in Asian American immigrants, Latino immigrants, African American, and white parents? So here, the Asian Americans are immigrants only, and Latino immigrants are isolated only immigrants, but African American and white, they are not immigrants. And the second question is, what are the health literacy level of Asian American immigrant parents related to their child mental health service utilization? So if the health literacy is related to the service utilization, that's number two. The last one is, are the health literacy level of Asian American immigrant parents related to their children's mental health and well-being? I included health and well-being to give you more comprehensive understanding how the health literacy impact on health and mental health outcome. Okay, the data set that I utilized to answer these three questions is 2007 California Health Innovation Survey. I utilized this 2007 data set because this 2007 data set only include the health literacy. The CHIS data set is sort of cross-sectional telephone survey conducted every 2 years, but then they only include the health literacy scale in 2007. So my sample size, that's why a little bit limited, but still I can look at the Asian American immigrant population. This data set is also have oversampled Asian Americans. If we look at the population-based health, any health data set, there are not many data sets that oversampled Asian Americans. So this is the only one so far oversampled Chinese, Korean, Vietnamese, and Filipinos. So this is a great way to look at the Asian American immigrant health and mental health. And then this data set has 5 languages, so they administered 5 languages to get this whole subgroups of Asian Americans, so which is very, I see that precious data set we can use for Asian American population's health behavior. So here are the dependent variables. I utilized 2 dependent variables, which is mental health service utilization and depressive symptoms. And then I include self-rated health status of children to look at the health outcome. And then here are dependent variables. My focus is the parental health literacy. This is the focus of this study. And then I have other control variables, like for parents, I controlled parents' age, gender, whether they are living, and then income and English proficiency. And then for children, I controlled age, gender, current asthma status, ADHD, insurance status, and dental insurance, and general health status. to only look at the relationship between health literacy and utilization and health outcome. All right, data analysis. To look at the levels of health literacy and utilization, I utilize univariate analysis, and then to look at the relationship between the parent health literacy and children outcome, I utilize regression analysis. All right, let's move on to the result. For participants, their parents, the age range is 18 to 84. I was surprised that there's an 84 years old parent. Yeah, so anyway, it's good to know, right? Yeah, and then there are about 1,200 Latino, and then 782 Asian parents, and then about 670 African American parents, and then 4,700 white parents. There are more woman parents than man parents, and then the majority of them living in urban areas. And then the children, the age range was 4 to 11, and then more boys than girls. There are 5,000 boys than around 4,700 girls. And then most of them, you can see here, almost all of them except 440 had a health insurance, which is a really good sign, so that children are covered by health insurance. And then for adolescents, the age range is 12 to 17 years old, and then again more boys than girls, and then most of them are insured. Okay, here's the table for parent health literacy level. There's here non-Latino white, Latino immigrants, Asian immigrants, and African Americans. Here's my question. Who has the lowest health literacy level among these four racial ethnic groups? Latino immigrants, right? And the next one is Asian American immigrants, right? So that we see that the white parent has the highest of literacy level, and then African American, and then followed by Asian and Latino. So surprisingly, it is not Asian immigrants, it's more like Latino parents are having the lowest literacy. So yes. Of immigrants? It's first generation only. Yes. Yes, they are recently arrived in the United States from other country in Asia. And same as Latino. The Latino is the first generation immigrants. Yeah. Okay, so here's the bar graph for the levels of health literacy across the four racial ethnic groups, and you see that the Latino immigrants are having lowest, and then this is statistically significant as compared to non-Latino whites. So the second research question was the utilization, right? Service utilization. It is parent health literacy related to the health service utilization. Unfortunately, we didn't find the relationship. So the parent health literacy did not predict mental health as well as health service utilization in any groups. But for health outcome, the parent health literacy significantly predicts health outcomes in Asian American children only, not adolescents. So we see that the Asian American children's health significantly related to their parent health literacy level. What about then mental health outcome? The parents' mental health outcome, the mental health literacy the health literacy is significantly predicts mental health outcome in Asian American children only again. So it's only the children, not the adolescents, which is also interesting finding. So here's the regression analysis for Asian American children mental health outcome for only the children, parents' health literacy mean scores predict the mental health outcome. All right, so conclusion. Well, health literacy did not predict mental health outcome for all groups, only for Asian Americans, and not only for the children, not adolescents. So which is very, very interesting. I think this finding suggests that health literacy may be barrier to poor mental health outcomes for only certain ethnic group. It's not umbrella, the critical area. So that, when we work with Asian American immigrants and their children, we need to be very careful about the parents' health literacy level. And also, although health literacy may be low in immigrant populations, just like a Latino, right? The Latino has the lowest, but not really their parents' health literacy related to the utilization or mental health outcome or health outcome. So I believe that although health literacy may be low in immigrant population, it may be a barrier only for the certain groups, right? So that's the kind of number one lesson that I learned through this data analysis. Now, another thing is that contrary to expectations, health literacy was not significant for teen utilization or teen mental health outcomes. So this, findings may be explained by teens have more control over their health decisions than children, right? So adolescents can say, Mom, I have a problem, I have a fever, I need to go to clinic, or I feel very maybe sad, I feel very, depressed. They would say that. Then the parents can take them to the clinic or mental health providers, all that. So maybe that's the reason that there's no relationship between health literacy and the mental health outcome for adolescents. And then teens do not realize when they are suffering from poor mental health, so that maybe they don't really ask, their parents to go to the mental health clinics. So this is kind of my interpretation of my findings. Another, thing is that this data set has a lot of limitations, so I need to acknowledge when we interpret these findings, there are a lot of limitations. First of all, we used health literacy construct, not the mental health literacy construct, right? So this is sort of a limitation of using the secondary data set, because this is not beyond my control. I cannot enter mental health literacy scale into this data set. So, this is huge limitation, but, the existing research suggests that the true health literacy item utilized in this data set is a good representation of health literacy scale, so that, this is still okay to use looking at this relationship. And another limitation is that I aggregated the Asian American subgroups into one Asian American immigrant. I didn't look at the Korean, Chinese, Filipino, Vietnamese, the subgroups, which is really big limitation. But the 2007 has really small number of Koreans and Chinese and Filipinos, so I couldn't really look at the subgroups of this Asian American population. So that's the limitation. And then I don't really look at the non, I did not look at the non-Asian or non-Latino immigrants. So I'm reanalyzing this data set, looking at the the white immigrant and then African American immigrant, and then I like to compare if this relationship is also reported in this African American and the white immigrant. So I acknowledge that there are some limitations. But there are some implications for practitioners, social workers, and psychologists, and mental health care practitioners. Our study results suggest that poor health literacy may be associated with lower health and mental health outcomes for their children, particularly among Asian American parents. So this is like a take-home lesson that we can get from today's presentation. So practitioners need to recognize poor health literacy and devise ways to increase health literacy among their clients. So I'm sort of suggesting this innovation strategy, the health literacy screening. Before you talking to your Asian American immigrant parents, you probably want to know what is their health literacy level, right? So there's one item question to kind of, look at the parents' health literacy. How confident are you filling out medical forms by yourself? This is one question that you can ask to your clients to look at their health literacy level. And then, the response choices extremely, quite a bit, somewhat, a little bit, and not at all confident. Okay, so if the parents say not at all confident, then you immediately, see that, okay, I need to tailor my, communication with this parent, maybe fourth grade level or sixth grade level, right? Do not use whatever the technical terms in the mental health area. Like you may not use schizophrenia or PTSD, something like that, because they're not going to understand you. You need to find out the way that you communicate with your client. So here's the one item scale. Another one is two item scale, which I utilized in this study. Number one is when you read the instructions on your prescription bottle, would you say it is very easy, somewhat difficult, or very difficult to understand? And then another question is, when you get your written information at a doctor's office, would you say that it is easy to difficult to understand? So ask these questions and see how the parents responded to these two questions, and then you sort of kind of see that where the parents' health literacy may be. And then if I go further, there's a 3-item questionnaire. The CDC, starting from this year, they inserted these 3 questions in their BLFSS, the national data collection, to see what are the health literacy level in the nation. So this BLFSS data is conducted by every state. So which is good, so that we can now look at each state's health literacy level. But anyway, the 3-item is how difficult is it for you to get advice or information about health or medical topics if you need it. The second one is, how difficult is it for you to understand information that doctors, nurses, and the health professionals tell you? It's more like a communication focus. And how difficult is it for you to understand written health information? So you can use these 3 questions before you are talking to your client. So that's my presentation today. So I'm open to your comments, questions, and any suggestions for other, implications of the findings. Yes.
I'm wondering the relationship between self-esteem and of the parents and its impact on their children.
Mm-hmm.
And I'm wondering if there is not a connection because of the large role that the schools play in the health of their students.
Yes.
Because they have teen clinics, for example.
Right.
That the children can go without permission.
Right.
And then, the child is concerned about the child.
Mm-hmm.
Then they refer the child for an evaluation,
Mm-hmm.
which has to have an health part to it.
Right.
And then that, that the children are getting served.
Right.
The parents may not understand anything about their services and the why.
Right. I think that's really...
The participants probably didn't hear that online, so if you could repeat what the statement was.
Okay. Well, there's one like interpretation or suggestions about children's probably teen clinic or children clinic at the school level. She told you that because of the teen clinic is available at the school, maybe the adolescent health will be taken care of by this teen clinics. I think that's a really good suggestion. I interpret that as why there's no relationship between parental health literacy and the teen's health or mental health outcome. Because, I know that in Minnesota, in St. Paul, there's a clinics in high school or in middle school, so that whenever they have problems, they go to the clinic without the parents, whatever, permission or approval, right? So that I do not know that's happening in California, so that's what I need to find out. But then I think that's why there's maybe no relationship for adolescents. But children, we include 4 to 11. So 4 or 5, they don't go to school yet. They are in maybe preschool, they are in kindergarten, where maybe there's no, clinic at the, the facility. So maybe there's some, difference between these two groups. I think that's a brilliant suggestion that probably that's the reason that why you couldn't find the relationship in adolescents.
Dr. Lee, we have a question from one of our online attendees. They would like to know, are there barriers with individuals with their willingness to admit their difficulties? And do you have any suggestions to work around that if they are resistant?
Probably there are a lot of, the question was that, in California, there are a lot of undocumented Latino immigrants. My answer is that yes. I used to live in LA, California, about 10 years. And then I observed that there are so many undocumented Latino immigrants. But then for this data set, the interviewer did not ask about the legal status. So we cannot really tease out the undocumented immigrants in this data set.
My thought was that perhaps if that's true, then would those parents not seek health services, partly based on the fact that they're fearful that they're going to be, something's going to happen.
Right.
The status.
Right. And then the question was that because of the undocumented status, I think the parents may not seek the help seeking because they afraid of being disclosed of their legal status. I think that's true, but here we see that for Latino immigrants, we did not find the relationship between the parental health literacy and their children's health or mental health outcome, right? So I don't know why this is really not related. My hunch is that for Asian American community, in the parents, they are really gatekeeper. They are like a gateway to go to the clinic. We have some alternative medicine that we want to use. I don't know, for Latino group, they have alternative medicine, but then for our Asian American group, we have, alternative option. So that we go to like or or acupuncturist to show our children first. And then if the acupuncturist say, hey, you need to take your kids to the clinic, this is not that I can taken care of, right? Then we do that, later on. So there might be that kind of one step, to the alternative medicine, maybe worsen the health status or mental health status. Maybe that's my kind of interpretation. And then in the mental health problems, as I introduced at the beginning of the stage, we have a huge stigma around it, so that we reluctant to take our kids to the clinic, particularly for mental health problem. So that might be also related to that, how the parent health is related to the health or mental health outcome.
I was questioning the role of stigma, especially as a child begins to mature and become perhaps more integrated into the dominant culture and understand that it's not so stigmatized.
Mm-hmm.
Maybe that, it's hard to tether out stigma anyway,
Mm-hmm.
but that would be, I would be curious about that.
Yeah.
The adoption of the cultural norm of the dominant culture influencing perhaps a teenager to be less stigmatized.
Right. Yeah.
It's hard, again, you can't, that's very hard to tether.
Right. Yeah. The comment was that I think the role of stigma is huge in terms of seeking the mental health services. I said yes. I think it is really, really true for Asian American community because of the huge stigma related to the mental health. I believe that for adolescents, like you said, they are able to say something, right? Or they can talk to school counselor so that they can have some alternative to go to the mental health services. But for children, they are still young, and then there may be no school-based mental health clinic, so that they're sort of vulnerable to take care of their mental health problems when they have them. So I think the stigma in Asian American community, it has a lot of role, but in my data set, there's no stigma scale, so I cannot really see how that impact on this relationship. That's my further study.
Do you have any assumptions or hypotheses about what might help reduce the stigma in the future?
Okay, the question is that what do I have any hypothesis or any assumptions to reduce the stigma in the Asian American community? Well, I think education. I think education is the primary key to reduce the stigma. We need to educate Asian American community, saying that mental health is like a health problem. Like a depression, you can get the depression just like you get the flu or cold. It's not just unique or stigmatized problem. Everybody in the world, there's a lifetime chance to get the depression. Myself, have a depression, particularly in the winter. and then I say that I'm depressed because I see the different body reaction and my mood reaction, right? So that we need to educate these people that it's okay to be mentally ill. There is a way to, cure it. And there's a medications, there's a talking therapy, there's a lot of other things that we can do. So I think education is very, very important for this population. As well as the health literacy education is also need to be there. Yeah. Any further questions from the audience or in the class?
Dr. Lee, can you hear me? Dr. Lee, can you hear me?
Yes.
Chat looks red. Go down on the chat, see if there's a
Yeah.
chat there.
Here?
There's the arrow down.
Right.
See, just take this and put the arrow down.
Oh, this one.
Mm-hmm. See if it's popping up that way. There we go.
Oh, there you go. Okay, I'm going to read the one question. Are there barriers with individuals with their willingness to admit their difficulties? Do you have any suggestions to work around that if they are resistant? I think it is about the health literacy difficulty by the parents. So are there any barriers with individuals with a willingness to admit their difficulties? Yes, there are huge barriers. When I work with Asian American clients, I try to look at their level of health literacy by asking, the one questions. Do you have any problem when you read a prescription bottle? And then they said yes, right? And then yes means that they have a problem, right? So that I try to, tailor whatever my communication level to that participant level of health literacy. But if you provide like a 10-item health literacy scale to this client and say that I like to look at your health literacy level, then there's a lot of resistance from the clients. So you want to judge my health literacy level. There's a lot of like a defense mechanism and a lot of resistance there, right? So instead of my suggestion to you is that instead of use like a scale or forms or whatever written in kind of forms, use your conversation. Just like an everyday conversation. Okay, based on my experience with the clinic, I think sometimes I have a problem, this and that. When I read my, prescription in my chart, I don't know what to do with. Sometimes I have a problem. Is the same to you? Is that the same case to you? So that sort of making the health literacy measurement more like in your conversation instead of using the forms. I think that will reduce the resistance level from the client. Any further questions? I think that's the only one I got from the WebEx.
Okay, then I think we're done.
All right. Thank you so much for coming and then listening to this presentation. You have my email address here, so if you have further questions, then just email me. Thank you.
Thank you very much.
Thank you, Dr. Lee.